Good afternoon. Hope everyone had a great Easter. As always, the Mayor President will say a few words and answer a few questions, and we also have Dr. Stefanski here. So, Mayor President Josh Gillard.
Thank you, Jamie. Thank you, Jamie. And good afternoon. Thank you for coming. Today, we have 360 positive COVID-19 cases on a base of 14,143 tests in Lafayette Parish. We have recorded, unfortunately, one more fatality, which brings our total to 14. Our 14,000 tests represent more than 13% of all tests in the state, or greater than 1 in every 8. I am proud of the level of testing that we've done in this parish to date. Since we began, testing in Lafayette Parish has ramped up significantly. Nearly 6,000 results have been reported in the last 3 days, compared to 8,000 in the over 2 weeks prior. It would take all day to thank everyone who deserves credit for this outstanding effort to provide testing to our people here in Lafayette Parish and across Acadiana. And we have with us today Dr. Tina Stefanski, and she is a big part of this ramped up effort. So thank you, Doctor, and thank you for your leadership in our medical task force. We have pre-screened and tested thousands of our citizens from Lafayette Parish and throughout Acadiana since March 18th when we began. The screening site fulfilled its need and did exactly what it was supposed to do. It helped our parish get a head start on testing, and it helped lighten the load for our emergency rooms. This morning, we had a call with members of our medical task force. Based on their unanimous recommendation, this Wednesday will be our last testing date at the Cajundome screening site. At this time, fewer people are coming through, and there is greater availability in tests, including quicker tests which are now available through our local healthcare institutions. Working with our medical experts, we have determined that this is the best way to utilize our resources going forward to continue fighting this virus. Our 311 line for pre-screening will continue so that our citizens can determine whether they need to be tested. The medical professionals will continue to pre-screen and will have information regarding where testing is taking place. I thank everyone for exercising social distance over the Easter weekend. We need to remain vigilant over the next 10 days to 2 weeks, as we will soon see how well our Easter holiday social distancing worked out. Medical experts warn about the possibility of a second surge in the future when guidelines are relaxed. So we definitely want to avoid that here in Lafayette Parish and Acadiana. If this experience has taught us anything, it is the importance of our local teamwork. We know that it takes time for the federal government and even the state to ramp up in times of emergency. We understand that we can't wait for others and need to be self-sufficient whenever possible. We have seen firsthand the power of what happens when we work closely together toward a common goal. In the wake of this pandemic, we are challenged to rethink many things that we have taken for granted. We can no longer rely on 8,000-mile supply chains for all of our needs. Our reliance on others for our critical needs like food, drugs, and medical supplies has been brought into sharp focus. In the coming months and years, we have a significant challenge and a major opportunity to become more self-sufficient in as many ways as possible, as a parish, as a state, and as a nation. We need to make local government more transparent, efficient, and accountable. We need to do more with less. We need to use our entrepreneurial ingenuity to grow and diversify our economy, especially following times such as what we're in right now. I look forward to a robust and civil conversation as we address these challenges and opportunities together. Now more than ever, we must buy local, shop local, and find ways to support our local businesses. Buy American, buy Louisiana, buy Lafayette. From our pharmaceuticals to our crawfish, shop local. At this time, let's please take a moment of silence, as we so often do here late, to think about those we've lost to COVID-19, both in this parish and across the world. Please join me in prayer. Thank you. I have time for a few questions, and again, we do have Dr. Stefanski here for our medical questions, leader of our task force. We have Chief Benoit and Chief Morgan also here for any questions that would fall into their area of expertise. Any questions, Al?
From what I understand, the reason for the Cajundome closing now is because back whenever it opened, testing wasn't widely available, but now people seem to have a lot of options.
Yes, so very thankful for that. When we first started the Cajundome screening site, as you said, Neil, the tests were hard to come by. We had to really pull together our resources, from personnel to equipment to leadership. And again, look, thank you to Our Lady of Lourdes. Thank you to Lafayette General. If it wasn't for our local healthcare leadership, we wouldn't have been able to set up a screening site that quickly. I remember, and Dr. Stefanski was there, we had a meeting that Monday morning, and by Wednesday, the 18th, we had it set up and we was running. And I think we did 6 hours that day, if I'm not mistaken, right, Don? Something. Our CAO's giving me a yes, good. All right, so thank you to that. But as the fight evolves, the battlefield evolves. And right now, we have more testing kits available. We have more rapid tests available in certain healthcare systems. And the need for the screening site is no longer there. Today, we only had just over 20 vehicles that came through, just under 30. Jamie Angel will be able to give you some more statistics about the Cajundome screening site. But we're continuing to fight this fight very aggressively. And to all my wonderful residents here in Lafayette Parish and across Acadiana, this fight is not over. The battlefield shifted. Where we take the fight to the enemy has shifted. Right now we're fighting it more in our hospitals. And because we have more supplies and because our testing kits are more readily available, we now can defer to our healthcare systems in the hospitals, in the ERs, in the walk-in clinics to take the fight to the enemy. Any other questions?
Yeah. You talk about, okay, we're still getting reports from people of businesses like smoke and vape shops, tobacco shops being open. Do y'all have any plans to enforce the closure, or are they exempt?
Yeah. No, we will definitely enforce the executive order that's binding on our parish governors. But I see Chief Benoit. Chief, can you come say a few words here as far as enforcement? Because this, and thank you, Claire, for that question. We do get this question asked a lot in regards to enforcement. We have a wonderful fire chief here with Chief Benoit that's joined us here today. And Chief, if you could talk a little bit about the enforcement of this executive order.
Good afternoon, everyone. We are out there physically enforcing the orders about maintaining closure and maintaining distance. As we get complaints, we go out there and we talk to the business owners. We give them the understanding and explanation as to why you should close and remain and keep that distance, and they're cooperating with that. We have not having to take anything to the extreme to where we would have to pull somebody's power, and that's something we would do with the administration with approval once we look at the particular situation. But as we see it right now, we're not getting a whole lot of complaints from the public or any other business saying that this business next to me is open or they're not practicing social distance.
Was there anything this weekend on the residential side where, there might have been so many cars in a driveway to where someone called being concerned that people were still gathering in groups larger than 10?
Although there were some gatherings, we didn't get any complaints saying that it became a nuisance to the neighbors. As we drive around, we look for those type of situations, and we can't tell you that we saw something that caught our attention to where we had to go into that particular area and say, okay, you can't do this.
You said you did?
We did not.
So unless somebody calls and complains that tobacco shops and vape shops are open, y'all aren't gonna do anything?
We're patrolling with the police department, but we're not specifically targeting anyone unless it becomes obvious. But if we get a complaint, we check out the complaint with an inspection, and then normally if they're doing it, they comply with the order and they close immediately.
What number should they call?
They can call the Lafayette Fire Department's number of 291-8716, or they can go through 911 and call the 911 number, and they'll transfer that call to the Lafayette Fire Department or Lafayette Police Department.
Again, thank you, Chief Benoit, and thank you to all of our wonderful first responders. We also have Chief Morgan here as well. To our police department, to our fire department, to our healthcare personnel, to our LUS workers, everyone you see on the front lines. Look, from our administration, from our community to you, thank you, thank you. And you know, Claire, we're working very hard to interpret an executive order, again, that no parish president issued, me included. But I will say this, the governor's office has been very easy to work with, and in questions such as those gray areas, we have a good line of communication with GOSEP. Colonel Wascom is the leader of GOSEP here at the state level. He's doing a great job. And our local Lafayette OSEP office is also working with the governor's office to interpret his executive order. So good question. Any other questions of me?
Yeah,
Yes,
although
sir.
people at the Cajundome screening site, although they weren't getting out of their cars, once that site does close, will there be any type of big sanitation effort there at the Cajundome, or is that even necessary?
Oh, we take it very seriously. Chris, we sanitize the area frequently, and Dr. Stefanski can talk to us about maybe some contamination efforts that she has some expertise that I don't have. But I will tell you this, you know, Chris, you bring up a really good point, and when all this is said and done, the Cajundome will get a good cleaning. And it needs to. But also, to everyone out here, when you go to these events in the future, the Cajundome, once we open, just know that we've gone out of our way at the Cajundome screening site to make sure that it's safe, that it's sanitary, and that we're proactively working with our healthcare professionals to make sure that we don't contaminate any areas that are unnecessary.
And I know you are saying that people still need to be cautious moving forward, especially going into the next 2 weeks. Have you all had any internal conversations about when y'all think stuff might start to reopen, or are you all sort of taking guidance from the governor and the president on that?
Well, yes to all of the above. So yes to continuing to practice social distancing. Again, if there's been a theme over the last few weeks, the number one line of defense starts with me and you. It starts with us at home, self-responsibility, personal responsibility. Wash your hands vigorously. Wash them throughout the day. Try to avoid touching your face. Exercise that 6-foot social distancing. Again, to our media out here, I know you can't see behind those cameras. They're doing a good job social distancing, got a couple arm lengths in between them. So good job. That's where it starts. But we are taking guidance from the president, and he's doing a good job with communicating daily. The governor's doing a good job communicating daily. We are operating as if his order will expire on April 30th. Now, it's my understanding that he's going on right after us. So depending on what he says, we'll go forward appropriately. Any other questions? Yes, sir.
I've asked this question before. It's kind of more of a check-in on this topic, but have you guys really started to get a handle on what kind of budget cuts you're going to have to make? I saw a report today, just the kind of expectation of the hit that might come on cities like ours that rely on sales tax. I mean, what are you guys planning to do on that?
That's a great question, Chris, and you should continue to follow up with that question. Everybody should continue to follow up that question. The administration, the councils should continue to follow up that question. Did you pick it up? So just for everybody, just to clarify, the question was regarding Christian asked about budgets and what are we have any idea of budget cuts? I will say this: when the dust settles, and as the dust is settling, we must continue to ask ourselves, what is an essential government function? That dialogue needs to happen. That conversation needs to happen. What is an essential function of government? You start with that, you take care of the essential functions of government, and you go from there. Everything's on the table. Any other questions? All right. Dr. Stefanski will address you with address any medical concerns and take your medical questions. Again, thank you for what you do, and we appreciate you. God bless you. Thank you, Doctor.
You may not have any questions for me. No? Do you have any questions?
I have some questions for Facebook. Are clinics now testing people outside of high-risk individuals?
So I think you're going to see over the next couple of days that guidance come from the state level. But yes, so clinics are testing individuals who are symptomatic because as we know, the picture has changed, and the high-risk conditions that are leading to the most serious illnesses continue to be hypertension, diabetes, and kidney disease. But we know that really all individuals with symptoms ideally are tested. So as testing capabilities is increasing across this region, this state, this country, you will see more encouragement for clinicians to test anyone with symptoms. But I do want to clarify that right now we do not have testing capability or the test available to test asymptomatic individuals. So individuals with symptoms absolutely should be tested, and again, we should have greater availability throughout this parish in this region over the next couple of days. But asymptomatic individuals, so people with no symptoms who are at home and just curious if they might have had this infection and recovered, that's an antibody test, and we don't have that test available for the community just yet. You hear a lot of talk about that nationally, and so we expect over the next couple of weeks we will. So again, still symptomatic individuals should ideally seek out testing.
We keep hearing leaders say that the curve is starting to flatten. Should they be saying that at this point? Because people might be overly
right. So yes,
ready to go out.
So I'm so glad you asked that question. So it does look like we're seeing social distancing or physical distancing work. So it is. It looks like at this point it's effective, and that the rate of infection is flattening. So that's where you see flattening of the curve, thankfully, and that was the intent of social distancing. So did what it's supposed to do. So great job to our community for following those directions. But yet we have not seen our peak. It's likely that we have not seen our peak in Louisiana. And so even in Acadiana, when they look at the numbers and when we might see our peak, with social distancing, we've kind of pushed that curve to the right. So we might, instead of this big peak, we might just see a slow rise and then a decline in cases. But that could be into June, July, August. So we have not reached our peak. Our hospitals are still seeing a steady number of patients present to the hospital and be admitted. So we're definitely still right in the middle of this virus affecting individuals. So we don't want people to back off. We want people to persist. Don't be complacent. Again, we're still seeing individuals admitted to the hospital. We still have many individuals on ventilators, individuals still unfortunately losing their life as a result of this virus. So we all need to do our part, take our cues from the governor, from the president, from our parish leaders, and stay home, continue to keep that distance between people so that we can drive this level of infection down to a point where we won't see that widespread community transmission.
I'm curious if you could just more specifically define what we mean by a peak. Because a couple of times I'm getting stories, sometimes in the national media, some state media, where they say, well, Louisiana's past its peak, some people say it's coming. I mean,
there's so many different models. There are just lots of different models, lots of different academic institutions who are looking at numbers of testing, of individuals who've tested, individuals who are hospitalized, and then based on that, based on the rate, try to predict when we might see our peak or our greatest number of infections in the community. And so Louisiana actually has done very extensive modeling, and so the models for our region show us reaching that highest level or highest number of infections, that we haven't reached that yet, that's to come over the next couple of weeks or months. And really the goal, right, is that we don't have a peak, because that's what we were all trying to avoid, that great peak or high number of infections where you get an overload of our healthcare system, which again is not in anyone's best interest. So the idea is that hopefully as people continue to keep that distance, and even as we go back to kind of our more normal lives, I expect that there's going to be some changes so that we will continue to keep some distance to avoid spread of infection between one person and another, so that we again see that increase and then slow decrease.
Saying in the next couple of months, or Acadiana, or the whole state, or both?
So Acadiana, so that's the state modeling for Acadiana, but those numbers change all of the time. It's just, again, as we do a better job of avoiding contact and spread between individuals, we see that come down. And so at some point it may again just be a very gradual increase and decrease.
I know that you've been hoping to see modeling for our area in general. Have you been able to see some of that modeling for Acadiana, and what you get out of it?
Yeah, so the Louisiana Department of Health had a call last week with the hospital leaders, hospital administration throughout our region, just to review these modeling data, and that's what I'm quoting, is that we expect to see this greatest increase sometime actually this summer. But again, that changes every day. But that's the best projection as of right now. But the better job that we do of driving the level of infection down, the less likely to be a peak and more just kind of that gradual curve and then decrease. And it's really for hospital planning purposes. The reason that we met was so that hospitals could look ahead and plan for what their capability needs to be in order to meet the continued increase in cases.
So when you're saying highest, is it like the cumulative number of infections? Is that what we're pegging it
Yes,
at?
it's
Or
in
the
the
day-to-day
community.
increases?
So the day-to-day increases in our community infection, yes, rate of infection or rate of transmission in the community.
So the peak that we're referring to is number of new infections each day will peak later?
Yes.
Okay.
The numbers that the health department puts on their website every day at noon, are those the numbers y'all are looking at? Are they
Yes.
pretty?
They look at those numbers, rates of hospitalizations, and also, yes, they look at the number of new cases, the testing, individuals who test positive, but especially the rate of hospitalizations. Since we don't have widespread community testing yet, one of the most consistent and best numbers for us to compare is rate of hospitalization. So individuals who are seriously ill and needing hospitalizations, that gives us the most consistent number to look at as far as the transmission in a community. And hopefully with more widespread testing, we're going to get more and more information that will help guide decisions.
Citizen asking, are you getting results back from the Lord's quick test kits?
So we get the state public health, Louisiana Department of Health gets all test results through all commercial labs. So yes, we will get those as well. And I want to just mention the Cajundome testing. I know there may be some anxiety about that site closing. So 311, and I'm sure Jamie's going to mention this in his remarks, will remain open. And so what we're doing is through the Office of Public Health, we're gathering a list of all community testing sites. So for people regardless of insurance, whether or not you have insurance, if you're covered by Medicaid, private insurance, we'll get all that information and then share it with 311. So as individuals will still be directed to call 311, who will help it will help those individuals to know what testing site may be most appropriate based on, again, geographically where they are in the parish, and then also regarding their type of insurance or if they don't have insurance.
A couple of cases in at least one death, maybe 2 deaths, of people in nursing homes in Region 4.
Yes.
And family members have said nursing homes are not necessarily letting the families of other patients know that that's going on. And one of them told one of the TV stations, I believe, that the nursing home even said if the person didn't die from COVID-19, that they died of a stroke, even though the doctor said it was COVID-19. So what are y'all going to do about that? Can y'all make the nursing homes at least let residents know about it, if not the public?
All right, so that's something I'll have to follow up with our health standards, our Bureau of Health Standards. But from our perspective, what we do in working with nursing homes is to try to reduce the spread or rate of infection in a nursing home. And so we work very closely with them. We're supplying them with PPE so that their staff are protected, and then also helps to decrease transmission from among staff members and among patients. The notification, we urge nursing homes to notify family members of individuals who are under their care, but that's not something that we have authority over, but I can certainly follow up. The Bureau of Health Standards. But frankly, I'm not even sure, yes, that that is even under our purviews.
More question. Dr. Stefanski, over the weekend, we saw, I believe it was Operations General, had a cluster of employees that were diagnosed with COVID-19. Have you all seen any other hospitals with that issue here in the Acadiana area?
So I'll just answer the question generally, but as you see nationally, we've had healthcare workers who have definitely been infected and sick as a result of this virus, which is why, we just implore the public in order to reduce the spread of infection in our community and to protect our healthcare workers, because they are front line. So as doctors, nurses, the housekeeping staff, everyone in those hospitals are very intimately caring for patients and are exposed. So we really urge individuals to stay home. That's what you can do to help protect your healthcare workers. But yes, Acadiana has not been spared. Our healthcare workers have been exposed and in many cases become ill as a result. Thank you.